All right, thank you. So today, like the topic was shared, we are going to discuss safe listening practices for our healthcare environment. And this will be the outline of the presentation. I'm going to give an introduction. Then we are going to talk about understanding noise in healthcare, then safe listening guidelines. When we talk about occupational noise exposure, it is noise that workers are exposed to at work or during the period that they are at work. We quantify the noise exposure at work as occupational noise exposure. And like every other noise, no matter where you are exposed to noise, high level of noise can cause permanent hearing loss. We call that type of hearing loss essential neural hearing loss. And because it is noise-induced, we classify it as noise-induced hearing loss. Now, one bad thing about noise-induced hearing loss is that it is irreversible. It is something that cannot be reversed. So it means that we have to really protect our hearing from noise-induced hearing loss since there is no cure for it. Now, is it only hearing loss that we can get from excessive noise at work? The answer is no. Several studies have found out that excessive noise at our workplaces can lead to stress and fatigue. So when there's a lot of noise, you see that your concentration is reduced, even your performance is reduced. Then excessive noise at work also leads to communication problems. That can lead to error. And this is very dangerous, especially in healthcare. I will give you an example. Let's say that there's so much noise that you are told, bring 15 liters of this. But because there's a lot of noise, or maybe 15 milligrams of a particular medicine, but because there's so much noise, you had 50 instead of 15 because of background noise, then you will see that it is going to even lead to medical error. So our healthcare environment should be controlled in terms of noise to avoid these errors and accidents and even medical errors and negligence. Then excessive noise also has physiological effects: cardiovascular problems, sleep disorders. Now, I spoke with someone who works in an intensive care unit, and the machines, the machines are a lot. It's always beeping. And when the person is off from work, sometimes the person tells me when she sleeps, she can sometimes hear the machines beeping. And when she wakes up, she's unable to sleep again. So these physiological effects, cardiovascular problems, sleep disorders, are all associated with excessive noise at the workplace. All these studies that these things that we are talking about, they are backed by research. People have researched the effect of noise on the healthcare workers. And they have seen that it is true. A study by Morrison et al. In 2003, they investigated the association between noise and stress among nurses. So what they used was a questionnaire, and then they measured salivary amylase and then heart rate. Now, what they saw was that noise, when there is excessive noise, the heart rate of those nurses were very high. They recorded very high heart rates among the nurses. tachycardia, as well as they were stressed, they were annoyed. So noise leads to those physiological changes, stress and annoyance, higher heart rate, tachycardia. Then, is it only healthcare workers that noise affects? No, even the patients. So there was another study by Dube et al. In 2008. They also surveyed patients to identify the noisiest time of the day, and also for the patient to tell them what particular thing or what particular noise annoyed you the most. And the patients, when they turned in the survey, they saw that from morning to noon, where there are lots of activity at the wards, that is where the patient says is the noisiest time of the day. And also, the most annoying noise was people talking. So as healthcare workers, we are also encouraged to be careful of our environment. Maybe you might meet your colleague and you are talking on top of your voice and all that. Those type of noise can also annoy some patients. Then also let's consider that some patients may have conditions that may make them very sensitive to noise. Example, there is a condition called hyperacusis. There are some people, they are very highly sensitive to noise. Then a patient could also be on the autism spectrum disorder. And some of the people on the spectrum, they have high sensitivity to noise. So as healthcare professionals, we have to take all those things into consideration before we talk on top of our voices. Now, how do you know that in my workplace, I think noise may be a problem? These are some of the things that you will notice. Now, immediately you leave work, you hear ringing or humming in your ears. We call it tinnitus. And anytime when you leave work, you hear that ringing. Or when you are talking to a colleague, you have to shout before the colleagues hear you. Then you know that the background noise is too much. And that is why you have to talk on top of your voice for your colleague to hear you. And even if my fellow speech and language therapists are here, they will tell you that even straining your voice, you could, also develop voice disorders from talking on top of your voice. So noise in the workplace does not only affect your hearing, it can also even affect your voice, because then you will have to shout to compensate for the background noise. Then, when you also have temporary hearing loss, it's like your hearing has gone down because maybe you were exposed to high level noise at the workplace. I will give you an example. When you go to maybe a concert or a church service where the drums are so high, and then immediately you go out, you experience that temporary shift in your threshold. We call it temporary threshold shift. So it's like you have a bit of a hearing loss because you have left the noisy environment. So if you experience some of these three things, then you know that the noise may be a problem at your workplace. The statistics is alarming because about 22 million US workers, where studies have been done, are exposed to hazardous occupational noise. And sometimes when we talk about occupational noise, we think about those who are in mining, construction. Of course, we know they use machinery, big machinery, and they are digging. Those who work at the manufacturing sectors, they have the highest prevalence of noise exposure. Yes, that is true. But then, in every sector, every working sector, there are noise exposed workers there as well, including the healthcare sectors. And that is why we are talking about it now, although maybe None of us is a mining worker. None of us is a construction worker. None of us is working in manufacturing. But then we can also be exposed to noise. How is noise measured? Exposure to noise. We measure it in decibels. We usually use an airway sound level, so we call it dBA. Now there are standard sets for exposure to noise. Every worker should not be exposed to noise above 85 dB without a hearing conservation program. And we say it should be time-weighted average. So what that means is that it doesn't mean that be exposed to the noise for 8 continuous hours, because the table that I am showing right now shows us the duration per day, total weighted time that you can be exposed to a particular sound level. Example, immediately it shifts even by 2 decibels from 90 to 92. Your duration should be 6 hours per day. When it goes to 95 dB, the total time that you should be exposed to a 95 dB sound per day is 4 hours. When it goes to 97, it's 3. 100, it is 2 hours. And so on and so forth. You see, it goes down to 30 minutes, and some of the noise levels, you have to be exposed only 15 minutes the whole day. So imagine you are working and the noise source is more than, it is maybe 115 dB, and you are working on a patient using that sound for 2 hours. It means that you are exposed to too much sound, and then the duration per day is also too much. Now, in healthcare settings, what are some of the sources of noise? 1 is medical equipment. 2, our own human activity. 3, the building, or what we call structural sound. So we will discuss some of these in details. You will ask yourself, the one that I brought you a table, but then in healthcare settings, are there acceptable levels of noise? Yes. 3 key organizations are responsible. The World Health Organization, they have their acceptable standards. Then the International Noise Council. I'm using the Environmental Protection Agency of USA. But every country should have the EPA specifying the acceptable noise levels in hearing or in healthcare settings. Now, you will notice that there is a little bit of difference between the WHO standards, the International Noise Council, and then the EPA. But when we strike the average, it will do. For instance, during the day, the WHO wants the hospital noise level to be 35 dB. And during the night, to be 30. The International Noise Council wants during the day to be 45, in the evening to be 40, and in the night to be 20. Then the EPA wants 45, 35. How do we understand 45, 35? And then how? I'm going to show you some examples of noise. When you look at the decibel scale here, you see the threshold of human hearing is 0. Yes, humans can hear even at 0 dB. When you are breathing, the normal breathing is 10 dB. A very quiet room without anybody talking is 20 dB. That is how the WHO wants. No, one of the people is the International Noise Council. It wants the room to be very quiet, no talking in the night. Then a whisper, when I whisper to you, it is 30 dB. I'm giving you this for you to know what levels we are talking about and how quiet the healthcare setting is supposed to be. You see, if somebody is snoring moderately, then that one is entering 40 dB to 50. Normal conversation is usually around 45. I have put that even on the right. On the right, you see noise of normal living or talking is 45. That is normal. If you are talking, you are not talking on top of your voice, it should be 45. But then research has found out that learning or concentration is possible, but distraction can occur at 40 dB. If there's so much noise at 40 dB at the background, there could be confusion. I brought this to let us know that if there is too much noise, and as healthcare workers, we don't want confusion. Like I said, bring 15 milligram, then you bring 50, because lives are at stake and it could lead to medical negligence. So this is showing us that when we are talking at our workplaces, we should mind our voices so that confusion doesn't occur and distraction also doesn't occur. Now, the picture on the right shows you a typical ICU. In the ICUs, people chat. Conversations could be as loud as 75 to 81 dB. The oxygen equipment is humming around 70 to 77 dB. The air condition is giving around 60 to 67 dB. The respirators are giving around 49 to 72 dB. The alarms are going up to 84 dB. Then in the operation room, the suction, 55 to 60. The pulse oximeters are giving around 60 dBA. And yes, conversations also around 73 to 82 dBA. So you see that all these do not even fall within the acceptable levels according to WHO or any of the acceptable levels that we give. These, they do not fall anywhere close to those levels. Then there could be structural sounds generated by the building. Example, the doors, or maybe the handles of the doors, they are creaking. All those things also generate noise. Now, there was a systematic review of 33 studies that examine environmental noise in hospitals. And those 33 studies that were done worldwide, we could see indoor noise in the hospitals ranging from 37 to 88.6. So you see 88.6 dB is at the extreme. Then 38.7 to 66.8 dB in the evening, it falls nowhere near the standard, you know. And those noise levels were not measured only in the ICU, but in a wide range of settings, intensive care, even the waiting room, private room, dental clinics, you know, infusion centers, emergency rooms. Now, in the operating room, it is serious. If you are a surgeon and you have joined, you can listen to this. ORs usually, they surpass 60 dB. But those in maxillofacial operating rooms, so if you're an ENT surgeon here, you can listen up. Noise were recorded as high, it was even exceeding 115 dBA. Remember, when we go back to this table, for 115 dBA, you should be in it for 15 minutes, a quarter of an hour, 15 minutes. So imagine you are doing a maxillofacial surgery on a patient, and the surgery is producing that noise, and you are going to be in the noise for 1 hour to 2 hours. Because 115 dBA is equivalent to a siren, it's equivalent to a firework, it's equivalent to a rock band. So if you are doing this surgery without any protection, or you are a respiratory therapist, you are in the operating room for those number of hours, you are any healthcare professional in the operation room, there are monitors, everything, you know, they are also producing their own noise. and then the drilling that is going on is also producing that noise of 115 dBA, and there is no protection whatsoever, then you've been exposed to more noise than necessary for more duration than necessary. So we have spoken about where the sources of sound in our healthcare environment. What are safe listening guidelines? One is to monitor our noise levels. Now, we have seen the noise level, the acceptable noise levels. And we have also seen that we shouldn't be in noise level more than 85 dBA for a weighted average time of 8 hours. So we have to be careful. We can measure our noise levels. Wherever we are at work, we can measure the noise levels. Now, it is very easy. At first, we could only use a sound level meter to measure noise levels. But now there are apps on our phones that can measure noise levels at the workplace. So as we can see someone doing here, the person is measuring the noise level. You may not have a sound level meter. Use apps on your phone to measure the levels so that you can be aware of the noise level that you are in, and then you can know how to deal with it so that you don't expose yourself more than necessary. So you measure, and then you see that, the noise is a little bit high. You can use hearing protection. You can use hearing protection. You can see a nurse fixing her hearing protection. She's being smart. She has measured the sound. She's seen that, no. So let me use the hearing protection so that it will attenuate the sound a bit. Like I said, there's a caution here. It also depends on where you are working, so that you also do not, prevent yourself from hearing a patient talking or something like that. But if you are in the ICU, the respiratory therapist, you are in the ICU, and you find it appropriate, you can use hearing protection when necessary, if it won't interfere with anything. Then you can practice the 60-60 rule for listening devices. Some people, when they are working on their own, they want to use hearing devices. Maybe they are using their AirPods, and it will be in their ear for a very long time. No, you will keep the volume down below 60% of the total volume. Nowadays, some phones, they have inculcated the hearing scale in the phone, so that when you are increasing the volume, you get to a point it tells you too high. Don't go more than 40% of the total volume. Keep the volume below 60% when using your headset. And do not use your headset the whole day. Do not use your headset the whole day, please. I think I went back to...
Yeah, your presentation mode, please.
Yes. And do not use your headset the whole day. Use it for 60 minutes at a time, and that's all. Then you take a break. And if you want to use it again, then you do. But do not use it for more than 60 minutes. Please bear with me as I go back to the presentation mode. I don't know where the whole thing went.
So kindly flip your phone or rotate your phone.
Rotate the phone landscape and then press play.
The phone is on landscape. Like this. I don't know. I don't know what is happening. You let me, I will be done soon. Let me finish with the presentation.
Okay, please go ahead.
Okay. So, then again, like I said, before everything happened, what was I saying? I was saying that do not use your earphone more than 60 minutes at a time. Also, we can implement what we call noise reduction strategies. You know, we have seen that the noise does not affect only the patients, only the healthcare workers. It also affect the patients. So we can close the patient room when possible to minimize external noise. Also, if some alarms are not really needed, we can lower their volume when clinically appropriate. Of course. Then, when we spoke about the structural sources of noise, sometimes how we even build the hospitals and with what material. In the beginning, if we employ what we call engineering controls, there won't be so much noise. There are some hospitals that there is so much echo, what we call reverberation, because you know of how or what materials they were even built with. So in that case, you have to use sound absorbing materials like I came back. You can use sound absorbing materials like carpet, or you can use acoustic panels, you know, to minimize the noise, the structural noise that is coming. Also, we can fix door handles. Maybe the door handles, they are creaking. You go and call the maintenance people in a month, they haven't come. But we need to maintain all those things. There was a study by Kruger, and it was an ICU, I think a neonatal intensive care unit, a NICU. So they did some structural modifications to the ICU. And the noise levels came down by more than 10 dB. So it shows that even structural modifications can bring about noise levels. Then there are several studies now ongoing. So there is a whole lot of avenue for research. Some people were trying to analyze the spectral formation of the noise in the ICUs and in the NICUs. That is it high frequency noise? Is it low frequency noise? Does the low frequency noise have high intensity than the low frequency noise? Now, I didn't quote those studies into details because a few of them have been done and they are conflicting studies. Some found out that it is rather the low frequency noise that are coming from some of the alarms. Those have high intensity. Other studies also are showing that it is rather the high frequency noise. They have the high intensity, or they are the loudest. But we need more studies to see whether we can do what we call, we can drown some of the noise. When we see that it is this frequency, we can drown some of the noise. So a lot of studies are needed, especially in this avenue, to see which controls we can or what we can do to bring some of the alarms down, because we can all agree that some of the alarms are very necessary. The monitors are very necessary. They are monitoring, a patient. So you cannot say, don't use the monitor to protect your hearing. But then what can we do to bring the levels of the monitor down. So we need a lot of engineering controls, and it involves a lot of studies to be able to bring the volumes down. Also, how do you improve communication in noisy environments? So now, granted, you've not been able to, bring the volume down because the monitor, the respirator, they are all, bringing a lot of noise. But that notwithstanding, you have to communicate very well with your colleague so that there will be no medical errors. There will be no mistakes. So you can use what we call closed loop communication. When you say it to the person says it back to you for you to agree that, oh, that is true. That is what I was saying. Did he say 15 milligram? 1.5? Oh, yes, I said 15 milligram, 1.5. So that the person doesn't go and administer 50 milligram. So that is what we call closed loop communication. Nowadays, you've seen that most of the hospitals we have shifted from using verbal orders to written orders. Even some of the orders are given via computer, where you log on to the patient's portal and you are able to see it. It is also an excellent way to overcome communication, especially in noisy environments, using written orders. Also, you want to discuss something very important with another colleague, because you can see that for our healthcare, it is multidisciplinary. You have seen something, an audiologist have seen something, or a respiratory therapist have seen something, needs to discuss with the audiologist, but not in the noisy environment where the monitors are beeping. It will make you talk on top of your voice, and you'll be contributing to the noise in the ICU. So you move to a quieter location when you are discussing critical information. Also, some hospitals have implemented what they call listening breaks. So you'll be in the ICU for a while, you'll be in the noisy environment, the operating room, you are a surgeon, you are doing the surgery in the operating room. There are times you have to take what we call listening breaks. Listening breaks. So there's a quiet room, you relax, you take a listening break. We have seen that noise, if it even increases your annoyance, it increases your stress levels. So for you to be efficient, these listening breaks are needed so that you take a break from all the stresses and then you come back. For professionals, you are a respiratory therapist or you are another professional, you are always working in the ICU. No, there should be a rotation. So you work in the ICU for a while, you take a break, you work at another area where it is quieter for a while. So there should be a rotation. Don't have to be at one place for a very long time. Oh, I've been working in the ICU for over 33 years. No. You work maybe a month, every month you go on rotation. You come back, you go on rotation, you come back. So that you are not, exposed to the noise all the time. Now, educational noise reduction programs. Yes, I was glad when Dorothy contacted me and asked me to speak about this topic, because most of our healthcare professionals also do not even know that too much exposure to noise causes all these type of things that we are talking about. So, like the education that we are doing now, it is the most helpful. It is the more inexpensive way of reducing noise in our healthcare environment. Remember the study that I spoke to you about. This study, I'll go back to the study where the patients were also, a survey was done, and the patients, the study by Doom et al., when they surveyed patients to identify the noisiest time of the day and also what they found most annoying. Now, after this study, they did education for the nurses and the healthcare workers over the noise reduction. And they saw that after they have done the study and they came back to take a survey, most of the patients didn't find that annoyance anymore, because now, then, the healthcare workers are conscious of some of the annoyances of noise. They know what they should do to reduce noise at the workplace. So the patients didn't complain as much as they complained when there was no educational noise reduction program. So audiologists are there. Audiologists can be contacted. If there is more than 85 dB, I spoke about a hearing conservation program. Audiologists are able to draw a hearing conservation program for people working in the mining sector, construction sector. So if you measure your operating room, your ICUs, and you are seeing that no, the noise levels are too much, you can contact an audiologist. We will draw a hearing conservation program for you. We will come measure the noise and draw a very nice hearing conservation program for you. In conclusion, what have we said? We have said that exposure to loud noise has negative effects on healthcare professionals. It can cause prolonged exposure to noise. Excessive noise can give you what we call noise-induced hearing loss. And noise-induced hearing loss is irreversible. There is nothing that can be done about it. Apart from the noise-induced hearing loss, it can also cause stress. It can increase your annoyance. Your heart rate can go very high when there's excessive noise. So your sleep can be disordered. You're always hearing beep, 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 beep at the ICU. Now when you sleep, the noise is beeping in your head. You wake up in the night, you are not able to go back to sleep. So sleep disorders, all these things. And for patients, the patients are also affected by noise. So measures should be implemented to ensure that noise levels in healthcare environments, they remain within the acceptable limits. And some of the measures are what we have mentioned, that we should look at the structural things, the structural sounds, the things that bring sound to the place. Is it the door? Is the door creaking? Is it the handle? We should fix them so that they won't produce a lot of noise. Also, when we are in the hospital, we should see the way we even speak. We shouldn't talk too on top of our voices. I have given you the hearing skill, so you know if you whisper, if you're having a normal convo, this is the decibel. And if you're talking on top of your voice, it enters another decibel altogether. When some alarms are not needed, we should put them off for now. If the noise levels exceed a certain limit, 85 dB, we shouldn't be in it for more than 8 hours a day. We should use hearing protection when necessary. Also, we should take hearing breaks. If you are working in noisy environment, take a break. Thank you so much. These are my references, and you can ask your questions. Thank you.
Thank you, Madam Elsie. Please post your questions in the Q&A session. If you want to identify the Q&A, go to more on your and then click more. When you click on more, you see Q&A. That is where you're going to post your questions. Thank you. I have questions for you. So Alice Akwejuram says, I know of a surgeon who likes to perform surgery with background music. He says it calms him down. Please, is this advisable, especially with other equipment beeping?
Yeah, I should have touched on that as well. So one study found out that it is not only that surgeon who likes background music. Several surgeons, they love background music. But then, like I said, we should also be mindful of our patients. If you are doing a surgery on a patient, the patient has a hyperacusis, a high sensitivity to sound, and or the patient is on the spectrum, and you are playing. So we should be mindful. And then how loud is even the sound? That one is also a factor. Like I said, we know the acceptable levels. I have given you the WHO level, acceptable levels. So the music, how loud is it? See, so all these things should be taken into consideration.
Okay.
Then the surgeon playing the music in the background, and when he gives it increases the background noise. So when he gives instruction to the people that he is working with, won't that also distorts the communication? Won't that cause communication difficulties and communication errors? All those things should be factored in.
Okay, thank you. And how does the quality of our listening impact our ability to interpret and respond to sound effectively in different environments? So the person is asking about how does the quality of our listening impact our ability to interpret or respond?
Yeah, so the quality of hearing is very important if you can be able to understand, it is it's all joined together. Let me say, you hear something, it goes straight into your brain, then your brain interprets it. So your ability to hear it very well will enhance your ability to interpret it very well. So they go hand in hand.
Okay, thank you. And from Pacific, he says, my first question, in healthcare facilities, typically in neonatal department, infants can be exposed to some noise from ventilators, etc., which impact can have to the hearing system of the infants, and how can we prevent it? So this is to the NICU.
Yes. So the NICU, the noise levels in the NICU can also be very, very high. Like I said, a lot of studies is needed. So as we are going home, we should be thinking about it. Can we liaise with or can some healthcare professionals, can we liaise together to do a study on also the noise levels in the NICU? We saw that for the ICU, the noise levels were as high as about 86 dB, which is high. And we do not want noise to, impact on the hearing of the child. But the child is now growing. Now, what happens in noise-induced hearing loss is that the hair cells, noise destroys them.
Okay.
That is what happens. And because the hair cells, they don't grow back. That is why we say noise-induced hearing loss. There's nothing that can be done about it. So yes, in the NICUs, we should also try and see how we can bring the noise levels down so that the hearing of the children are not affected.
Yeah, because this particular question is very important because we have a lot of neonatal care practitioners on this webinar paying attention. So I'm sure they would address it to their authorities to do something about it. Okay, so how would you classify music therapy in the ICU? Do you recommend this? Do you recommend this is done in a different unit? For example, in the ICU, I've even witnessed it. Sometimes when the patient is lying in bed and in the cool of the day, we want to just play some cool music on the background for them to just relax. Is this advisable?
Like I said, we are not allergic to noise. We are not saying all type of noise is bad, but we are talking about levels. So please use your app and measure the level of the music and let it be within acceptable limits. That's all.
Okay, somebody said we play music sometimes in the hospital and we have a policy for no earpods, etc. How do we manage this situation?
They play it in the hospital where?
So they said we play music sometimes in the hospital. Like what I said earlier on, sometimes they want to just play music at the background in the IC. We play
I
music in the hospital sometimes. And there is a policy of no earpods, no earpods. Okay,
Yeah,
how
so if
do
no
we
earpods,
manage
then I
this
don't think
situation?
if no earpods, then I don't think it's the ICU that the person is talking about. Maybe at the nurse's room, or where is he talking about?
Okay, so please, the person who posed this question should be specific so that we can address it. Okay, so from Ebenezer, I said, what are some major implications of noise on patients?
Like I said, noise can cause stress on the patients. If somebody is really sensitive to noise and there's too much noise, the heart rate, the same thing. Like it causes in the nurses who were um, tested, their heart rates can even go high. You see, there is even a link between noise and cardiovascular issues, like I said, tachycardia and all those things. So if the noise is too much, it's also going to create a lot of stress in the patients. And we don't want that because we want them to be well. We don't want that. And annoyance, the survey, some of the patients said they were annoyed.
But I also wanted to add that at least for the national patient safety goal. So in the US, there is the government comes up with a national patient safety goal. And even though it doesn't specifically address noise, but there's a lot of things that is on the national patient safety goal that have been in a noisy environment could actually contribute to some of those things. And for the National Patient Safety Goal, one of the things is identify your patients correctly. Even though they are armband, when there is noise around, you don't want to have any kind of distraction where you cannot really identify the patient properly. You start looking at improving staff communication. You want to make sure that when there is communication between the disciplinary the different disciplines, there's not a lot of noise because there is important information that is communicated during this communication. So you don't want to either transcribe the incorrect information, because this could lead to a sentinel event that is going to touch the patient. When we start looking at using medication safely, we want to make sure that there's not a lot of noise where, nurses are administering medication, because we want to make sure that the medications that are ordered for the patient is actually what is ordered for the patient and nothing different. Because noise could cause a distraction, and a distraction can lead to a patient getting the incorrect information. So, noise is very, very important. In a healthcare setting. And, I see on the comments as well, people talking about the different ICUs. Some of the noise that we even have is even fire alarms. When you have a fire in a in a hospital where someone pulls a plug, that's a source of noise as well. So.
Yeah. Okay. Okay, so from Liberia, Ebenezer Zofle was saying, I'm a respiratory therapist assigned in the OR. How does noise affect post-operative patient? So, Dr. Gwenga, I think you can also take this answer as well with this.
Yes, I've been in the OR several times, and in there, there there are roles that are assigned to people to make sure that one, whoever is doing the surgery could hear what is going on, whoever is the circulating nurse could hear exactly, when a medication is ordered, how much is administered. It has to be communicated. In a noisy OR where there's a lot of things going on, you have machines going on, you have your monitors that is monitoring the patient's heart rate, blood pressure, vitals, everything is going off. We want to try to make sure that that is limited because when you are in surgery and there's a lot of noise, it could be detrimental to the patient, especially when you have organs that are exposed. You don't want to go and click touch a nerve that you are not supposed to touch. It's something that's vital. And I actually have I could share a story with you guys. We actually did surgery on a patient. It was brain surgery. And in those kind of surgeries, it's an awake surgery where you actually the patient has to be awake. That way, different areas of the brain that you may touch may actually have different responses. And you actually so the patient has to be awake while this surgery is going on. And because this patient was a musician and was playing an instrument. So during the surgery, so now picture someone whose skull is open and the brain is exposed, and the patient is awake, and the patient was playing a guitar. So if you actually touch a different nerve and that affects the part of the body, the patient stops doing what they're doing. That's how you know that yes, you have touched the incorrect nerve that you're not supposed to touch. And if you now introduce noise in this kind of environment, you cannot really do that because you're not going to be aware to pay attention to the different things that may be going on in your surrounding, that we don't get the outcome that you're not looking for. So noise, especially in the OR, it has to be limited. But there are, some noises that you want to make sure that, you avoid, and there's some noise that you want to make sure that you also have to know that, yes, there are things that is going on, and you have the right outcome that you actually need to have.
Okay. And then another question that came up. I love sleeping with my earbud or the earpods. The person is trying to say that. What do you advise? Because I find it difficult to sleep without music in my ears. So this is a question that is coming up. And then this question is well noted, it will be answered, but let me add other questions to it. And please, if you are an audiologist, connected or participating, you can also unmute your microphone.
Dorothy, I'm so sorry.
Yeah, okay.
I'm
Don't worry.
so
You didn't
sorry.
miss anything. We were also
I didn't miss.
deliberating. Yeah, we were deliberating on it and then
I am
giving out
so
our
sorry.
stories.
Please forgive me.
I know the
I
connection is
use my
that.
phone.
Sorry. So there's a question for
I
you.
use
There's a
I
question
use
for
my
you.
phone and the
Says,
phone went off.
sorry, the question is, I love sleeping with my earpods. What do you advise? Because I find it difficult to sleep without music in my ears.
Wow. So it means that you are exposing yourself more than 60 minutes at a time. You are not taking listening breaks. So please, how many hours is that?
This one is the entire sleep time, the whole night. The earbuds are in the ear. So the person wants an advice.
So please, the entire night. So it means you are doing around 8 hours with it. When I go back to I wanted to share something, but
you can't share the slides now. You just have to answer the questions so that because
okay.
questions are coming
I
in.
wanted to let her see the
Okay.
let me stop. I wanted the person to see the exposure time.
Okay, you can go ahead. If only it will not bring that distortion
It's
again.
okay.
Yeah,
It's okay.
yes.
So if you are doing 8 hours every day, and that is only when you are sleeping, Then there is the daytime noise that you'll be exposed to. So if the person can wean himself or herself and do the music via, if he has a Bluetooth device that can go lower, and then that would be advisable more than the earpods in the ear for that extended period of time.
Okay. All right. So the next question, I am very alert when I am very alert when I sleep at night. Okay, so in the sleeping time is very alert. The smallest movement or sound wakes me up from sleep, especially at night. What do you advise?
The person is a light sleeper.
No, like, you see, when they sleep, the least movement or the least sound, they are awake. So they always have interference in their sleep.
Interference in sleep.
Yes.
Okay, so there are some sleep muffs that people use over their heads to further attenuate sounds from outside. The person can get some over in the shop, anywhere that it is sold, and try that and see. It will attenuate the sound coming from outside. A very comfortable one, of course. There are some that are made of very comfortable material.
Okay. So, all right. And then another person said, how can hospitals effectively balance the need for clear communication, patient safety, and staff well-being while minimizing harmful noise level in healthcare environment?
So the educational, that's education. For instance, if we are all, hospitals, we come together, there's a monthly discussion or a weekly one. We can all discuss how. So we want to balance everything, like we said. The patient's care is paramount, but then the well-being of the healthcare professionals is also paramount. So what we do, like I said, is if we can't do anything about the noise, then I don't have to let Dorothy be in the noise for too long. So we could schedule in the morning. We measure the noise and we see that it is 90 dB. And for 90 dB, Dorothy can be in it the whole day. Dorothy is supposed to be in it for 6 hours. Or it is 92. Dorothy is supposed to be in it for 4 hours. We can let Dorothy do 3 hours at a time, or maybe 2 hours at a time. Go for a break while somebody else takes over. And Dorothy can go to a less noisy area and work and come back. So it can be an internal arrangement, like I said. When the education goes on, there should be internal arrangement. So if you are a matron or if you are in charge of the roster, assigning people, you should take all these things into consideration, so that you don't say you are working 8 hours straight. That is your shift. Yes, but then the noise level is too much. So the person has to be taken away after a period of time for another person to take over, and they can switch roles so that she will go to a less noisy area and another person will take over.
Okay, so this goes to all hospital administrators connected or hospital matrons connected, and nurses, doctors, and healthcare practitioners. Your health, your well-being is very, very important. So this is what you have to drive to your authorities. Dr. Lugbenga, you raised your hand, please.
Yes, I did. I wanted to share with you some of the things we apply at our organization to try to bring the noise level down. We actually have visual noise measures that are in different units. So as the noise level so it allows for people to still do their regular communication, and you see a visual display that is like a stop sign or traffic light where you have red, yellow, and green. So when everybody is talking and the noise level is within the decibel level, it is green, and it keeps on being green. And then when the noise levels start going up, it start changing from green to yellow. That means that, okay, well, we need to make sure that, yeah, the noise level are going up. We need to try to keep the noise level down, because it gives everyone a visual display as to, we need to bring our voice level down, because they have a visual representation that shows that, yes, it's gone from a green noise level to a yellow noise level. And if it's red, that means that the noise is too much. So it never really gets to the red, because as it changes from green to yellow, people will know that, hey, you know what, let's bring the voice down. And that's all through education, and awareness of your surrounding. But the visual display has helped a lot, because when people see that, well, the meter has changed from green to yellow, let's bring it back down. That way it is green. This is actually highly effective in our neonatal intensive care units, where noise, the babies are very, very sensitive to the
Yes.
to the noise. So that's one of the things that we actually have in different units at our hospital.
Yeah, that is so
That's
important.
interesting.
Yeah.
Yeah.
And I mean, talking about the neonate, Maud Fandor in Kolebu Teaching Hospital, Ghana. She's in the neonatal ICU. She says there are few studies about the negative impact of high levels of noise in the NICU. Outcome shows effect on heart rate, respiratory rate, which are all stresses on the neonates, as in the babies. The preterm babies especially are more vulnerable in these instances. So this is a call to action. That is why the Africa Respiratory Care Association has taken the opportunity to have this education for all of us. And indeed, Africa needs to do more research in this so that we can also have evidence-based results to support and then show our healthcare administrators, so that at least when they are procuring devices or procuring things for the hospitals, they can at least consider the well-being of the patient as well as the healthcare practitioner. So at least this is for us, Africa. This is our time. This is the opportunity that we have to actually tell our own stories, tell our own challenges, and present it as such. So thank you, Madam Maud. Then another question says, the hospital has sound system, especially in the hallway, installed in the roofs. What do you recommend? Like, for example, you could be in your office or certain area as a clinician, and then you hear the alarms and sounds. There's a patient here having seizures or this or that kind of sound. What can they do about this, or how can they minimize all these interferences?
So the person want to mean is an alarm system, and it comes on once a while, isn't it?
Yeah, because maybe a patient has coded, or maybe a patient is maybe experiencing something different, or there's a challenge. It announces to every unit. That kind of sound sometimes can even increase the heart rate of the clinician himself or herself. So what do you recommend in this particular case?
So like we are saying, through education, we should know that the sound shouldn't trigger in the whole area. I mean, if there's supposed to be a department where the sound will go. For instance, I will the ones that we have here. There is an alarm at the bedside of a patient. The patient clicks on the alarm, it goes to the nurse's station. It doesn't blow everywhere. It goes to the nurse's station, and they hear it, and they attend to the person. So if it could be same, so that it doesn't trigger, and then the whole area will be noisy, causing stresses in people, that would be better.
Okay, thank you. And somebody said, is it good for a patient that is undergoing treatment be playing music?
Oh, like I said, not all noises are bad. Maybe that is the patient's therapy. But the patient should also, if the patient is in a private room, why not? It should be low. The patient can enjoy it. Even tinnitus, ringing in the ear. Sometimes we also tell people to do music therapy for it. low music, and it calms the person down. So it is not wrong. Not all noises are bad, but we are saying how high is the noise. That is the difference. And then also make sure you don't, disturb others whilst maybe you want it and the other person, it is causing a lot of stress to the person. So all those things should be taken into consideration.
Thank you very much. Dr. Olugbenga, your hand is raised. Please, if you have questions, you can raise your hand as well, and then we'll call you.
I was just going to add that, we have patients that undergo music therapy, and that music therapy is part of their treatment plan. So, just like, Elsie had said, not all noise is good. The music therapy is a good form of noise that helps in the healing process of the patient. But I also wanted to address the alarm systems, and I wanted to try to give an example of what we do at our hospital here. We have there are some codes, and a code is a form of notification system where if we need to get the healthcare team actively involved, the code is announced everywhere in the hospital. As an example, we use a universal coding system for fires, and if there's a fire, there's an announcement saying that there's code red, which means that there's a fire and it will identify the location. That will go everywhere in the hospital. But if there's a code blue is a person needs immediate medical assistance. The code blue is overhead page. That way, the medical team that is skilled to care for that medical can actually respond. Now, but there's a difference, to minimize the noise in the daytime because a lot of people are awake, they will overhead page the code blue or the code red in everywhere in the hospital. But at night, the code is only paged at the location where the need is. So let's say you are in a hospital that has 3 different levels. And there's a code on floor 1. It's only floor 1 that's going to hear the code. That way, you don't page the code to 3 and 4, where some people may be light sleepers and now they hear all that noise and they cannot go back to sleep. Those are just some of the interventions that have been put in place. That way, you're not really trying to disturb patients during the nighttime. So, the noise, even though there are some noise that are required, it's still minimized. That way, patients that don't really need to be exposed to those noise are not exposed to it.
Okay. Any
But
more?
Abenga, so I can see that where you work, you are very advanced. Where do you work? If you don't mind me asking, you can type it to me. If it's security.
No, it's not. It's not security. I work Cedar Sinai Medical Center. It's in Los Angeles, California.
Mm-hmm.
Yeah.
Thank you. So you see that all these things start with the engineering. When they are building the hospital, a lot of thought is given to the structural, what goes into it, where the alarms will be. All these things go into the engineering of the hospitals. So otherwise, some of our, in less, I would say, in less developed countries, sometimes the architecture doesn't support all these things. I remember one student of mine did her thesis. She worked on a project and measured even the acoustics of the classrooms. Oh my days, were they off? They were so off. They they don't follow the standards. And so some of the hospitals, how the room is even designed, you talk and it bounces back. There's so much echo. All these things, so the engineering, it starts with the engineering. I think just like Dorothy is saying, a lot of data is needed so that we can say no. When engineering the hospital, take into consideration this, because the noises here are too much. When you are designing the alarm systems, make it in such a way that some alarms, just as you said, if it is something that everybody's life is in danger, then of course it is a proper panic. But if it is something that only the healthcare professionals are supposed to attend to, why should there be alarm all over the hospital for everybody to, be startled? People will be stressed, thinking what is happening and all that. Someone who is sick doesn't need all those things.
Okay. Thank you very much. So apart from hospitals, please, you're not just limiting it to the hospitals, even in industries that have lots of sound pollution. So this also goes to you. Another suggestion that I will also want to suggest is that with what she has said, hospital administrators that are here, or maybe hospital leaders that are here, I would suggest that if you can get devices that can measure sound level, which can be fitted in the ICUs or the hospital rooms. That way you are able to also measure it and then know how you can handle patient care, especially the quality of sleep of our patient and then the well-being of the healthcare practitioner. So this is something I think if those devices that you showed in the PowerPoint, if it's in the markets, I mean, people should patronize it. Yes, people should patronize it and then fit it in their hospital rooms. Please, you can also raise your hand if you have a question that maybe you can't type in the Q&A. Raise your hand, we'll call you. This is an interactive session, and then we'll be rounding up very soon. Dr. Benga.
So this is not a commercial for any company to say, well, go and buy this, but I wanted to talk about, the eye watches, because a lot of us use the eye watches, and sometimes when you wear the eye watch, when you are in a place that the noise level is actually high, and it doesn't have to be in a hospital, it could be anywhere. Your watch will alert you saying that the noise level is high. I don't know if people have encountered that, to that, and it's a way for you to be able to remove yourself. That way you don't really have the long-term effects of this noise. I also wanted to comment on the gentleman who said that he sleeps on the with the AirPods on, for an average about 8 hours of the day. Now, one of the things that we need to be aware of is the smallest bones in our body, is in our ears. So long-term exposure to sounds, unnecessary sounds, may actually damage those bones because they actually are in a state where it's vibrating, and that's how you hear what's going on. And there are times where you need to take time off where you don't really have any kind of hearing impairment. So if you are exposing your ears to long-term sound exposure, you may not really have any effects now, but then there may be some downstream effect where as you get older, you may now start having issues, with your hearing, where you may be, referred to an audiologist to go and measure your, if you could hear well, and maybe you even need, enhancements to be able to amplify the sound that you're hearing, because now the ears are not working the way it's supposed to be. So it's just more awareness and education.
Yeah.
Can I ask
Thank
you
you
a
for that.
question?
I also forgot to add one thing that I was also going to add. I mean, hearing checks are also very important. For instance, when we start work under normal circumstances, especially those who work in industries, they are working with machinery. You have to go and do an audiogram when you start. That is what will be your baseline audiogram. So if you are doing your annual audiograms, then we will see whether whatever controls that your work is incorporating, it is working, because we have something to compare. This is your audiogram when you started, and this is it when you worked for 1 year. Are you showing signs of noise-induced hearing loss? Then we can advise further for you to get further time away from the noise, or put in a lot of measures to reduce the noise that you are hearing. So when we are working, we should also insist that during our medicals, there are some hospitals, they will only employ you after you have done your medicals, or when they employ you, you do your medicals. Just add hearing tests to your medicals so that you have a baseline audiogram. Otherwise, two things are involved. If maybe you have a very difficult management, they are not hearing you, the ICU, or you are doing maxillofacial surgeries and you are drilling 115 for 2-3 hours. Now, in 2 years' time, you have a hearing loss. It is noise-induced, clear noise-induced hearing loss. Audiologist is telling you that this is due to noise. This is the pattern that it takes. Then your employer can say, no, it didn't happen here. You don't have anything. You don't have a baseline audiogram to compare this to. But when you were being employed, if you had a hearing test, then you can say, this was my hearing when I came, and this is it, and this is that. So that's even compensation or something. We don't want it to get to compensation, because hearing loss can be very devastating. It has a lot of psychological effects. So we don't want it to get there. But then my advice is that do a hearing test as part of your medicals before employment, anywhere you go. If you've not done it, start this year, please.
Okay, thank you very much. So, does anyone have any question? I can take only one question at this time before we wrap up. Does anyone have any question?
Dorothy, honey, can you ask you one question?
Yeah.
Please go ahead. Please go ahead.
Elizia Kusowa, thank you very much. And I want to ask you one question. Do you hear me?
Yes, I can hear you.
Can sound this cause patient with traumatic brain injury to develop hyperacusis within hospitals?
But you are breaking, so can you type it? Type it at the comment section and let me take it.
Okay, thank you.
Yeah, you can type it and I will read it for you. Any question again from anyone, since we have time? Any question? Any more question? If you have any question, you can type it at the Q&A. We can read it very fast for you, and then we can provide answers. Any comments, questions?
I think he was asking something about hyperacusis. I don't know. Let him type it and let's see.
Okay, so Dr. Ngozi said, great information. Yeah.
Thank you.
Yeah. Okay. Is the question ready? Okay. Also, if let's say after the webinar series, you have further
If
questions.
can sound cause patients with traumatic brain injury to develop hyperacusis?
Mm-hmm.
Well, it is not sound. That is what, if the patient has traumatic brain injury, then it depends on the part of the brain that was affected, isn't it? And the TBI itself can cause someone to develop hyperacusis.
Okay. All right. Thank you very much, Madam Elsie. Thank you for making time to present for us. On this note, on behalf of the Africa Respiratory Care Association, we say a big thank you to you. And dear participants, kindly note that this webinar series was brought to us by Zopec Medical. Now, Zopec Medical's theme is Powering Critical Care Mobility with Confidence. And what they are about is that they provide continuous power supply using the world's smallest battery to aid in the transfer or mobility of patients. They also support early mobility, as I said, and enhance physical therapy. And then these devices adapt or work with numerous hospital devices. So if you want more information about the Zopec batteries, I'm going to share their contact detail, and then you would also contact them. Please, if you can see my screen, Madam Elsie, you can say yes to me.
Yeah. I can
Okay.
see it.
Okay, so you can see the Zopec battery well displayed over here. So we have in Africa, we have a country representative by person of Jason Tobor. He's in South Africa. So if you want a battery of that sort, this is a very portable battery that you can even put in your handbag, but it is very powerful enough to power your medical devices. For example, your mechanical ventilators, your perfusers, or your heated high flow devices, or any device that you would use to transport a patient, be it transporting the patient from maybe the ICU to the ECG unit, or to take an X-ray, or to do anything, or even to walk the patient around. So if you want any of these batteries, you can contact him on the number displayed, and then the address is over there. If let's say you are in any part of Africa and you wanted to just contact him, he would identify a distributor in that country, and then we'll link you up. Also, you can also find out more about these batteries on their website when you go to the Africa Respiratory Care Association, or contact the number that has been displayed. So on this note, I want to say a big thank you to you all for making time to participate in this webinar series. The next webinar series comes up in the next 2 weeks, and it will be announced. Now, also note that since you have registered, the notification for the webinar or the link to join directly would come in your email, the email address that you provided. But when the flyer comes for the next webinar series, kindly share to everyone, because information like this is supposed to get a lot of reach. But these are the few people that made time to participate today. So the next webinar series, I'm counting on all of you to share the flyer, share the link, let them participate and get the knowledge. It's time for Africa. It's time for us to tell our own story. It's time to let it happen. It's time to save our own patients and then improve healthcare outcome in Africa. So this is bye-bye from the Africa Respiratory Care Association. On this note, we look forward to seeing all of you in the next webinar series. So Dr. Benga, if you have anything to say, you can also round it up and then we go.
Oh no, I think everything you said was well said, and thank you to our presenter today for giving us information on this valuable topic, and hope to see everybody at the next webinar. Thank you.
Thank you all so much.
Okay, all right. Bye-bye.
Yeah. So if Dorothy, if anybody has a question, because someone has asked the question again, and I don't want us to go back.
Oh, if you have a question, you go to the info@africaresp.org, or info@africaresp.org. When you go on the ARCA website, you can share your question, and then we would address it to you, the presenter.
Yeah.
Thank you very much.
Yeah.
Okay.
Thank you.
All right. Bye-bye.
All right.
Bye-bye.
Bye.
Widespread. It's time for Africa. Let's rise and breathe as one. With the Africa Respiratory Care Association, our journey's just begun. Promoting excellence, our mission strong and true. For every breath we take, ARCA's here for you. Together we will grow. Our goals within our sight. With ARCA's guiding light, the future's looking bright. It's time for Africa. Let's make our vision real. The Africa Respiratory Care Association, here to heal.